My reality is I was 12 years old, I was diagnosed with arthritis. Honestly, my first thought was, that is not true, that can't be, because my hands sort of hurt, no. The truth is, you can either say, okay, I have arthritis, I'm not gonna try to run, I'm not gonna try to walk too much, I'm not gonna, try to work. My reality is, no, I'm doing it anyway. Almost 2 months ago, I completed the New York City triathlon. I mean, I swam a mile, I biked 25 miles, and then I ran 6 miles. Almost 2 months ago, I completed the New York City triathlon.
Hi, my name is Seth Ginsberg, Creaky Joints co-founder, and I want to welcome you on the inside of the Infusion Clinic here at the Hospital for Special Surgery in Manhattan, New York. This is a very special place. This is a place where dreams are realized. This is a place where lives are restored. And today we're going to go behind the scenes and we're going to show you what infusion therapy is all about.
I think if you're doing well on a pill regimen, you wouldn't have to go to an infusion. But if your arthritis is active, you're having a lot of joint pain and swelling, or you're stiff for a long time in the morning, or you're very tired, it may be time to consider an infusion, which in some patients, the infusions are more effective.
2 hours here.
Right, and this is a
flat screen TVs, you've got the telephone, you've got the TV to watch.
right.
Chairs go back.
A lot of the times when a patient has to get an infusion, it really hits home that they have a disease because they're coming to a hospital, having to sit in an infusion room with many other patients. I want my patient to feel comfortable and at ease. So, for instance, here we have a very bright, new infusion center, and the nurses are very knowledgeable. So I tell them you'll meet a nurse, an IV will be placed, you can sit down and talk to your nurse or talk to other patients who have similar diseases. They're going to meet other people that are just like them.
It's really comfortable.
And now do you ever pack the place?
Absolutely, absolutely.
Really?
It would be 8:30, 9, 9:30, by 10:30 this whole place is packed.
Every
Done.
day?
Every day.
Most of the patients that need infusion therapy have swollen, tender joints. They're having trouble doing all of their activities of daily living. They're not happy with the control of their rheumatoid arthritis.
So this is where it's done. This is where I hang up the medication. Patient sits down, you've got your...
So just like this, they just kind of
sit down, you take your blood pressure, and you start your IV.
In most cases, patients have already tried the injectable tumor necrosis factor inhibitors, and despite taking those for 3 months or 6 months or maybe longer, they're still having joint pain and swelling. You have to give these drugs at least 3 months to know that they reach their full effect. So if you've been on a TNF inhibitor that you're giving yourself every week or every other week and you're still having a lot of joint pain and swelling, then you probably would be a candidate for an infusion, a trial of an infusion.
When I first started, I had no idea what to expect, and I was just nervous at the thought of an IV. And my mom went with me, and we brought games, and I was young, so the nurses stayed with me. But now, I mean, it's routine.
How old are you?
How old am I now? 28.
You have sort of this informal support group that it's true, when you're here for the first time, we try to be, obviously maintain confidentiality and privacy, but you can hear when you're sitting, a nurse is sitting talking to the patient, telling him, these are the side effects you hear, and you see the room and you can sort of hear it, and then someone will chime in, I'm on that drug, don't worry about it. And it's nice to have, it's one thing for the nurses to tell you what you might experience during the course of the infusion. It's really nice for someone else to be the light at the end of the tunnel. Say, I've been on this, and it's okay. And you'll see when we do have a reaction. That's when we close the curtains, because clearly it's a frightening thing, and we want to give the patient a lot of privacy, and we have to do EKGs, and we'll close the curtain. But when the curtains open back up, and the rest of the room is there, everybody's like, how you doing, are you okay? I went through that too, it's fine, you're going to be fine. So there's a lot of, it's a very informal support, and there's a lot of reassurance from the group. When the patient comes in for any sort of infusion, we like to assess their health status, and that includes to make sure their blood pressure is in a normal range. Okay, so if someone's blood pressure is high, you would not necessarily initiate the infusion. You would stop, you would call the doctor, and then when the blood pressure comes down, then we would proceed with the infusion. We'll pretend we're starting an IV. Okay, so normally this is where I find the vein.
I usually tell patients that are on medications that are not controlling the disease activity and who are afraid to go on stronger medications that our goal here is to prevent damage. We're not giving you medications that we don't know anything about. We're giving you medications that have been well studied. We really know the side effects. So try not to be so worried about taking a new medicine.
I'm not about to try a medication that, no one knows anything about. It makes an incredible, incredible difference for me. I don't think I would be exaggerating if I said it has completely changed the way I go about my life. Before I started, I was on, a handful of different medications, and I took, at one point I was taking like more than 10 pills a day. Now I come in once, and it's better than everything else. I mean, the other medications, one would help the inflammation. I mean, I don't even know what they were all doing. This, I feel phenomenal. I don't feel sick. Day to day, I don't feel sick. I mean, I was diagnosed with GERD when I was 12, something like that. So to a certain extent, I don't remember exactly what it feels like to feel perfect or not to have arthritis, but this seems to be it. Since I was diagnosed when I was 12, I've always tried to be as active as possible because I was told, use it or lose it. So I just, maintained that, and that was good. But I would say that those days where I didn't feel well, the days when I woke up feeling really stiff, or the days where I just felt like I was going to fall apart at the end of the day, were much, much more frequent. And to be honest, I don't know if I could have done the race that I finished. I mean, I don't know. I wasn't in any position to kind of push the boundaries. I was just making it through the day and trying to be as normal as possible. Now, normal is absolutely within reach. I didn't think about it in the beginning of the race when I was swimming, because I was in the Hudson, so I was just trying to get out as fast as possible. I thought about it during the bike ride. I guess it was around the halfway point of the race, halfway through the bike ride, when I suddenly realized, oh my God, I'm halfway through this triathlon. I'm totally gonna finish it. I have arthritis. Oh my God, I can't believe it. And I just got so excited and so emotional, and then I had to focus because I needed to finish the race. If you're training for a triathlon, you have to be fairly athletic, and I guess they didn't expect someone with arthritis to also be fairly athletic and want to take on this big challenge, but I mean, I kept up. I absolutely kept up. A couple weeks before the race, I injured my ankle, and everyone was really supportive, and I was nervous, and my teammates kind of tried to keep me in check, and they tried to say, don't push yourself too hard, don't hurt yourself. But there was no way I wasn't doing it. This is a disease, but it's not going to debilitate you, and you can absolutely live with it. The decision to start infusion therapy can be a scary one. For me, it just was a solution that I couldn't find anywhere else.